We have in the Radio 4 studios Dr. Fiji Antony, who is a Chief Clinical Dietitian, NMC Specialty Hospital, Dubai. Say welcome to the studios, ma'am.
Thank you.
So how much is food and eating habits related to heart problems?
It's very much related. If you are not taking care of your food intake and if you do only the exercise, there is not that you are going to help you out of your health. Like you drink a lot and you smoke, yes, you are going to be in trouble.
Okay, so what are the dietary modifications that you would suggest for preventing these heart diseases?
The first and foremost thing is that you should have a regime. Like you should eat healthy food. When I say healthy food, that doesn't mean that you should eat only the brown food, wild rice. Whatever you don't eat should not be the criteria, It should be the food what you eat, but it should be modified in a healthier way. Like you are going for a curry, it should be like cooked and boiled. It's not that it has been seasoned topped with lots of oil and butter and it's a curry still. It should be modified in a healthier way in which that you are using very less oil, but the other ingredients are being permitted.
Okay, so ma'am, how can one modify one's lifestyle to prevent these heart ailments?
First and foremost, you should do some exercise. When I say exercise, again, it's not the gym. I'm talking about what is practical and consistent with your lifestyle. So you should walk maybe 20 to 30 to 45 minutes is the advised. That's the first and foremost thing. Second, you should not smoke at all. Third, you should have a food intake pattern that you eat food at regular time. You should not starve from morning till night. You don't eat any food in between. That's bad. So some food should be there. That doesn't mean that you can eat lots of nuts or lots of biscuits in between, lots of coffee in between. It should be something like low-fat yogurt or leban or some salads or a fruit or some handful of nuts like walnut or almonds.
Maybe can you suggest a daily diet plan for someone to follow that can be easy to follow every single day?
Well, it starts with whether you are staying at home, what type of job you are doing, what type of schedule you have, again, what type of shift you have. Some people do have 12 hours work, some people have 8 hours work, and some people will be on road for 4 hours to reach home. So it all depends upon person to person. There's no doubt about it. But still, a general guideline says that the first and foremost thing is that the breakfast is a must. So either it is at the office or at home or on the way. So that means it should be taken between 2 to 3 hours of your wake-up time. It's not that it is after 10 hours or 4 hours after your wake-up time. And then comes the in-between snacks. So there should be a snack between the breakfast and lunch. There should be a snack between the lunch and dinner. The lunch should be anything which is handy for you if you're working out. But if you're at home, yes, of course, you can go for a meal again. But if you're outside working in an office and where the food is not a main concern, that you are going to be out of the office in 8 hours. So you might just go for some salads topped up with grilled chicken or grilled fish or some kidney beans and some potatoes. That's fine. You don't have to go for a complete meal over there when you're at office because you're on a working schedule. And then you can have an early meal if you're coming home before by 6:30. And that could be a balanced meal with any of the rice or chapatis or bread or pastas, macaroni, whatever the carbohydrate serving. But there should be a protein and vegetables matching with that. It should not be only the carbohydrate and protein or only the carbohydrate and vegetable. Like for example, rice with chicken is carbohydrate and protein alone. It should be always balanced with some vegetables. So it could be a salad or saute or soup, but it is a must. And try to eat as early as possible, maybe at around 6-7 if you're reaching home. So don't have a snack as soon as you reach home if you're getting home by around 6. Instead, you finish off your meal and go for a walk and have a fruit before you sleep.
Okay, so what are the must-follow food guidelines for a person to stay healthy?
For your healthiness and for your fitness, the first and foremost thing is that you should decide what is your lifestyle. And what are the bad habits you have, you should stop. And what are the good habits you have, don't overdo it. Like I have seen people doing 1 hour, 2 hour in gym and not eating healthy food, going for the snack bars, going for the protein shakes. Don't do that one. The first and foremost thing is that it should be very much natural. Second thing, be active. Take the stairs and reduce your weight if you are obese, and be with the physician if you have any clinical conditions. So what we have recently seen is that people do ignore the clinical conditions so much, thinking that they know everything. So even if your sugar levels are on the borderline, please do consult the physician and take the medicine. Don't say that I can manage with the diet and exercise. It can end up with a heart disease very soon.
Thank you so much, ma'am. It was a pleasure having you here at the Radio 4 studios. Main hu Faizan. This is Radio 4. You stay tuned.